What if the pain you're having is greater than what's expected from your MRI, or even after having surgery? Spinal cord stimulation is a great treatment strategy for these cases. It's basically a pacemaker that's been expanded to 16 and now even 32 channels. These electrodes are placed over the spinal cord to essentially jam the pain signals coming from the legs, the back, arms, neck, and even the head. The brain no longer perceives these altered signals as pain, but instead as a pleasant, numbing sensation. The electrodes come as either multiple electrodes on a single wire, or called percutaneous electrodes, or the electrodes are configured on a paddle as shown here. These paddle electrodes need a small opening in the bone, or lamina, called laminotomy, or sometimes laminectomy. The electrodes can be activated in different combinations to focus or steer the current to exactly the nerve fibers carrying the painful signals, thus avoiding unnecessary stimulation. By adjusting which contacts are activated, as well as other parameters such as pulse width, stimulation frequency, the stimulation can then be fine-tuned to exactly where the patient is having pain. For instance, in this case, the stimulation is focused from the leg to the foot, where the patient is actually having the most pain. One of the great aspects of spinal cord stimulation is that the patient can test drive or experience the stimulation before the full permanent implantation. The trial is performed as a simple outpatient awake procedure through 1 or 2 needles shown here. The trial percutaneous electrode is slid up in the epidural space, similar to epidural catheters used when women deliver babies, except that here the electrodes are guided by fluoroscopy, so we know exactly where they are. Once the electrode is slid into the approximate position, the patient, while still on the procedure table, is awake and confirms that the painful areas that they usually have are actually covered by the stimulation. The patient then goes home with this trial system and can experience the stimulation in the comforts of home, doing the activities that they usually like to do. After a week, the electrodes are removed and the patient decides if they like the stimulation. If they choose to have the permanent stimulator implanted, either a percutaneous electrode, shown on the left, or a paddle electrode, shown on the right, is placed and connected with a battery implanted nearby. The stimulation can be adjusted by a remote control and can even be recharged through the skin by a recharger. The stimulation can be turned off at any time or further adjusted to get the stimulation just right.